I actually think it's ridiculous.
Everything's going up and wages aren't going up.
Aussies are set to be charged more than $100 for a standard non-bulk billed GP appointment from next month.
All costs for running a general practice have gone up. We're talking about rent, telephone, electricity, staff.
It's the third fee hike recommended by the AMA this year, a total increase of 5.8%, which is still below the official inflation rate of 6%.
I think the public is well aware of the increasing cost in providing high-quality general practice, how hard it is to keep the doors open and make sure that we can provide care to people when they need it.
So come November, what does the price hike mean for you? With consultation costs rising to $102 and Medicare rebates only going up 20 cents to $40.40, it leaves patients to pay the gap of $60.60. The average Aussie sees a GP 5.6 times a year, so that would leave them about $340 out of pocket. Make that a family of 5 and you're looking at almost $1,700.
Well, you'd think twice about whether you really need to go, wouldn't you?
When the little one's sick and we have to get in, you don't have a choice but to pay it.
For me, as a GP, I'm in an ethical dilemma. I absolutely believe that every Australian has a right to access affordable, appropriate health care. But, unfortunately, Medicare is no longer fit for purpose in terms of covering the costs.
In some good news, the government is tripling the bulk billing incentive. But there's a catch, with the changes only benefiting patients who are pensioners, welfare recipients or children under 16.
For a lot of people, $100 will be too steep, and that's why we're investing billions of dollars. Millions of Australians will benefit from our efforts.
So is the price hike justified to keep up with rising costs, or is this the latest nail in the coffin of Australia's universal healthcare?
So I currently have a job, which is great, but this is a pretty fickle industry, right? So I could lose my job really at any moment. But for the moment, if my daughter, the Rem dog, gets sick, we don't even think about it. We just take her to a doctor whenever we have to. But the idea that if times were tough or going harder for us, that I couldn't go to the doctor straight away because of the financial burden is really scary.
And ultimately, the burden on the government in the long term is a lot greater if people who have problems are not able to turn up to the doctor and seek help early on, because then, of course, those issues compound and then they end up in hospital and, you know, God knows what happens then. And we want people who are ill and who can't afford help to be able to turn up to a doctor and seek help before things get too bad, you know. But it is also a massive expense for the government.
Yes.
You know, to cover this for everybody, it's almost impossible. But at the same time, health is so important for people. And to not be able to go to the doctor, it's so hard.
But I also feel for the GPs there as well.
Of
like
course,
you talk about
yes.
the ethical dilemmas that we saw in that package about, you know, you've gone into medicine because you want to help people, and then you have to like turn people away or deny people coming to those appointments or you know, giving your own services for less than you normally would because you're just trying to help out. But then how do you resolve that with actually making sure that people can still get there when they need to?
Yeah, so tough.